It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in a series of questions from my client Robert, and the question last week was part 11 of my 68-year-old mother is in ICU with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is, my 68-year-old mother is in ICU with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? And that's part 12 of this series of questions. You can also find previous questions from this series of questions answered if you're clicking on the links below this video in the written version of this blog. And if you're watching this video on YouTube, just click on the links below this, on the link below this video. That'll get you to the website and to the other parts of the questions as well. So Robert continues with his mother's situation and he writes, "Hi Patrick, here is the latest update on our end. The insertion of the line for dialysis went without any complications and overall my mum is responding well to the dialysis. They estimate an extra 25 to 30 liters of fluids in her body, so it's going to take a while for them to get that processed and removed. The blood pressure medications are either off completely or very low, and blood pressure medications are called inotropes or vasopressors. Yesterday she had to be taken for a procedure to remove some fluid that they saw in the abdomen. The procedure went very well. They were able to get all the fluids removed. They didn't leave a tube in there to do future extraction. They've sent the fluids extracted for testing. Currently the issues are, first, yesterday she had a couple of episodes of bleeding in the morning. They monitored her throughout the day and they believe it has subsided. They are still seeing small amounts of blood through her nose tube, but it's darker, so they think it's from the original bleeding and there's not likely new bleeding, but they're still concerned. Number two, her breathing rate has gone up. Used to be 22 to 25 breaths per minute and now stays in the 35 range. They think it's because she's getting more and more awake. She'll try to open her eyes every now and then. Third, when the breathing rate gets to about 45 or so and stays there for a bit, they give her a little bit of pain medication. I think it's 50 milligrams of propofol. They say it's fast acting, which it seems to be because you can almost immediately see her breathing rate come down to 25 breaths per minute. And they saw it's not long-lasting. They seem to be good with pain management. Her platelet count is very low, about 30. They say it should be in the 100 to 150 range. Not sure what to do about that yet. Causes could be kidney function issues. What's your take? Number 5, her skin is super sensitive. They say it's because of the excess fluids. She's very easily bruised and has fluid seeming out of her pores. Hope is that as dialysis does its job, this will get better, but it's a little troubling to see. Number 6, neurology response is not dramatically improved yet, but she does seem to be fluttering her eyes more in response to our voice and is moving her mouth a little now as if she's trying to say something. She's got the tracheostomy now, so likely won't be able to talk for a while, but guessing it's a good sign that she's actually trying to move her mouth. Number 7, so far most of the decisions have been straightforward, like the tracheostomy and the dialysis, partly because she's never seemed in any pain and the doctors didn't suspect any. Now that she starts to wake up, it seems she may be in pain at some points, so the family will likely find it harder to watch. But we have convictions and are hopeful that in a few days we'll start seeing some positive improvement. That's all I have for now. All thoughts and feedback, and especially answers to the questions, will be much appreciated. From Robert. So here's my response. Hi Robert, I think that from your email, overall there is definitely some progress and also some setbacks. I will explain in detail from my perspective. I have answered all of your questions. I really hope that answering your question helps, Robert. Please let me know if there are any changes or any other questions. So you're asking the following questions. The insertion of the line for dialysis went without incident, and overall my mum is responding well to the dialysis. That's what I expect, Robert. Dialysis treatment most of the time seems uncomplicated and fairly straightforward. You're also saying they estimate an extra 25 to 30 liters of extra fluids in her body, so it's going to take a while for them to get that processed and removed. I think, Robert, 25 to 30 liters sounds like a lot of excess fluids. I've probably seen up to 10 liters. And yes, it will take a while for the dialysis to process the excess fluids. Next, you are saying the blood pressure meds or inotropes or vasopressors are either off completely or very low. Well, Rob, that's a good sign. Keep an eye on it if your mother has to go back on it or not. On the one hand, being off the blood pressure medications like inotropes or vasopressors is a very good sign because it shows that her infection seems to be reduced. One of the signs for severe infection usually is low blood pressure. Do you know what her other infection markers in the blood, such as white cell count, are doing, or also CRP? Does she still have a temperature? Next, you are saying, Rob, that yesterday your mother had to be taken for a procedure to remove some fluids that they saw in the abdomen. The procedure went very well. They were able to get all the fluids out. They didn't leave a tube in there to do future extraction. They've sent the fluids extracted for testing. So the question for me, Rob, is why is she having fluids around her abdomen? The first thing that comes to mind is that her liver might be impaired and she may have gone into some sort of liver failure. In one of my previous emails, I have mentioned low albumin levels as part of being very edematous or puffy. If she's having excess fluids in the abdomen to the point where they need to drain the fluids, there may be something wrong with the liver, hence the excess fluids and most likely a low albumin level. If I was you, I would try and find out what your mother's liver function is and what her albumin levels are. Do you also know if they have replaced albumin via transfusions in the last few days? It's good to know that they sent the fluids for testing. Next, you are mentioning that currently the issues are, number one, yesterday she had a couple of episodes of bleeding in the morning. They monitored her throughout the day, and they believe it has subsided. They're still seeing small amounts of blood through her nose tube, but it's darker, so they think it's from the original bleeding and there's not likely new bleeding, but they're still concerned. So my concern, Rob, here is that if your mother is bleeding, besides monitoring her platelets, as you've pointed out in number 4, they will also need to monitor her hemoglobin or HB levels. Hemoglobin levels are the red blood cells in the blood, and they should be at least 80 in a critically ill patient. Hemoglobin is the oxygen carrier in the blood. Therefore, especially with your mother still being ventilated, having an adequate and physiological hemoglobin level is vital to get her weaned off the ventilator. Do you know if they have replaced some of the blood she's losing with blood transfusions? Also, what are they doing to stop the bleeding medically? Have they stopped intravenous nutrition, TPN, and is she back on nasogastric feeds into her stomach? The earlier she can have feeds through the nasogastric tube and the less the likelihood of gastric bleeding. This seems to be particularly important in view of the fact that she had a stomach perforation previously. Also, do you know if they are giving her a pantoprazole infusion? Pantoprazole infusions are usually given whenever there is abdominal or stomach bleeding. It's a proton pump inhibitor designed to slow down acid production in the stomach to lower her pH levels and hence reduce the risk of bleeding. Next, you are saying, Rob, that your mother's breathing rate has gone up. It used to be 22 to 25 and now it stays in the 35 range. They think it's because she's getting more and more awake. She'll try to open her eyes every now and then. Now, Rob, if your mother's breathing rate stays above 35 on a regular basis, it's certainly a concern, and it's a sign of discomfort. It's often pain, but it can also be a sign that she's getting more awake and that she can't make sense of a situation or environment as yet. It would also be good to know what her arterial blood gases show. Next, you are saying, Rob, when the breathing rate gets to about 35 to 45 or so and stays there for a bit, they give her a little bit of pain medication. I think it's 50 milligrams of propofol. They say it's fast acting, which it seems to be because you can almost immediately see her breathing rate comes down to 25. And they saw it's not long lasting. They seem to be good with pain management. Now, you are probably referring to propofol or Diprivan here, Rob. They are giving her to reduce her breathing rate. Propofol or Diprivan is a sedative and not an opiate. Opiates are pain medications. Therefore, the propofol or Diprivan is only sedating her and is not giving her pain relief. Yes, propofol acts very quickly and is not long-lasting, and it will get her breathing rate down in the short term. But it does concern me that if she's in pain and they're trying to treat it with propofol and not with adequate pain relief. Do you know if they are giving her adequate pain relief in the form of morphine or fentanyl? Both morphine and fentanyl are strong opiates and would be appropriate to manage pain in a situation like this. Number 4, you're saying that your mother's platelet count is very low, about 30. They say that it should be in the 100 to 150 range. Not sure what to do about that yet. Causes could be kidney function issues. What's your take? Well, my take is, Rob, that this could be caused by kidney issues, but it could also be a cause of liver issues. Abnormal blood coagulation is usually a sign that the liver may be failing or that something else is going on in the blood. Low platelets, therefore, could be a sign of the liver failing, but sometimes it can also be a sign that when the blood is getting filtered through the dialysis machine, that some platelets might get destroyed. Do you know if they have replaced her platelets by giving her platelet transfusions? I would also be curious to know what her iron R is. Iron R is the prothrombin time and is an indicator how well her blood is clotting. Again, from the information you have shared, she may need some blood transfusions, either red blood cells to replace hemoglobin or platelets, or even FFPs, which stands for fresh frozen plasma, if her iron R is too high and is causing the bleeding. There is also the chance that the bleeding is caused by a leaking blood vessel, potentially from the surgery she's had a few days back. Next, you are asking that your mum's skin is super sensitive. The day it's because of the excess fluids. She's very easily bruised and has fluids seeping out of her pores. Hope is that as dialysis does its job, this will get better, but it's a little troubling to see. I can imagine, Rob, that this is very troubling to see, and yes, her skin would be super sensitive after having so much excess fluids on board. Make sure she's getting good pressure area care so that skin is not breaking down and potentially leave her vulnerable for a skin infection. She should also be on a special care bed and on a special air mattress to prevent any pressure sores. Number 6, you're saying that your mother's neuroresponse is not dramatically improved yet, but she does seem to be fluttering her eyes more in response to our voices and is moving her mouth a little now as if trying to say something. She's got a tracheostomy, so likely won't be able to talk. But I guess it's a good sign that she's actually trying to move her mouth. Now, Rob, that is definitely encouraging, and every little step she's taking, I believe, helps. If she's in kidney and potentially liver failure, she may need more time to wake up as her body is still severely weakened and she's still battling on many fronts. Next, you are saying that so far most of the decisions have been straightforward, like the tracheostomy and the dialysis, partly because she's never seemed in any pain and the doctors didn't suspect any. Now that she starts to wake up and seems she may be in pain at some points, so the family will likely find it harder to watch. But we have conviction and are hopeful that in a few days we'll start seeing some positive improvement. Yes, Rob, I totally agree that most decisions to this point have been very straightforward, even though your mother doesn't seem to make big gains at the moment. Trying to manage pain with propofol appears to be inappropriate from my perspective, as I mentioned before, and I would really try and find out what else they are doing to manage pain. Pain management in ICU is a real issue, but they should be able to get a handle on it with all the resources that they have. Of course, you as a family will find it very hard to watch your mother being in pain and also not progress as quickly as you would like her to. I think it's great that you are keeping the faith for positive improvements in a few days. That's the way to go, Rob. You never know what's going to happen, but staying positive is important. With all the information that you have given me, here is my quick summary and what I consider to be really important at this stage. So you've got to find out if there's potential for liver failure with excess fluids around the abdomen that needed to be drained. Also, another sign for the potential for liver failure could be the bleeding and the low platelets, and I also believe low albumin levels. Dialysis will take off some fluids over the next days to come. Adequate pain management is necessary and imperative to keep her comfortable, for example with morphine or fentanyl. The management of abdominal or stomach bleed needs to be done by pantoprazole infusion and blood transfusions. Management of low platelets, platelet transfusions to help stop the bleeding. I hope that helps, Rob. I wish you and your family all the best. Until next time. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.